We're diving into the Melan-A test in immunohistochemistry. This test plays a crucial role in diagnosing melanocytic neoplasms, including melanoma. Let's explore everything you need to know. Pre-test information. Before undergoing the Melan-A test, there are a few important steps and requirements you need to know. Firstly, it's essential to provide a copy of the histopathology report. This report contains details of the microscopic examination of tissue samples. Next, the site of the biopsy, or where the tissue sample was taken, must be clearly mentioned. Lastly, a comprehensive clinical history should be provided. This includes information about the patient's medical background, symptoms, and any relevant conditions that may influence the test results. These details help pathologists accurately interpret the test results and provide a precise diagnosis. Specifications of the test. So, what exactly is the Melan-A test? The Melan-A test is an immunohistochemical test that detects the presence of the Melan-A protein. Melan-A is a differentiation antigen produced by the MART1 gene. It's expressed in 100% of melanocytes, which are the cells responsible for producing melanin, the pigment that gives our skin its color. Diseases associated with Melan-A. Melan-A is primarily associated with melanoma, a type of skin cancer originating from melanocytes. The test is also relevant in identifying other melanocytic neoplasms. In fact, Melan-A is one of the melanoma antigens recognized by autologous cytotoxic T cells and serves as a target for tumor-infiltrating lymphocytes, making it a critical marker in melanoma diagnosis and management. Specimen used. Now let's talk about the specimen used for this test. The specimen used for the Melan-A test is typically a biopsy sample. This could be a skin biopsy, lymph node biopsy, or any other tissue sample suspected of containing melanocytic lesions. The quality and preservation of the biopsy specimen are vital for obtaining accurate results. Components included in the test. The Melan-A test includes several components, such as specific antibodies that bind to the Melan-A protein in the tissue sample. This binding is then visualized using a staining process that marks the cells expressing Melan-A, allowing pathologists to identify and evaluate melanocytic cells under a microscope. Test report time. So, how long does it take to get the results? Typically, the test report for the Melan-A test is ready within 7 days. The timeline may vary depending on the lab's workload and the complexity of the case. Detailed test information. Now let's get into some detailed information about the Melan-A test. Melan-A, the product of the MART1 gene, is a differentiation antigen found in 100% of melanocytes, most melanomas, and about 50 to 60% of melanoma cell lines. This antigen is crucial as it is recognized by the body's own immune cells, specifically autologous cytotoxic T cells. It serves as an antigenic target for tumor-infiltrating lymphocytes, making it a valuable marker in diagnosing melanocytic neoplasms. This antibody also stains Melan-A in normal melanocytes and the retina, but does not stain normal or tumor tissues from non-melanocyte lineages, making it a specific marker for melanocytic cells. The staining pattern is observed in the cytoplasm of melanocytes and other positive cells, which helps in differentiating between melanocytic and non-melanocytic tumors.